Do you feel like you're working harder than ever, yet keeping less of what you produce? For many of us dentists today, insurance write offs and PPO reductions are taking anywhere from 35 to 45% of production right off the top. And understandably, that creates a lot of frustration for all of us. It also leads many dentists to ask an important question: is there a better way to practice dentistry? Over the next few videos, I want to talk about some common fears dentists have about incorporating orthodontics into their practice and the facts that may change the way you think about it. Fear number one: my schedule is already too busy. This is one of the first concerns I hear from dentists about incorporating any new procedure, including orthodontics in. My schedule is already full. How could I possibly add orthodontics? Whether it be orthodontics, implants, surgery, any type of new procedure. And it's a fair question. We're already working with a full schedule, adding patients where there's no room. But here's an important fact about orthodontics in the general practice. Most orthodontic opportunities are already sitting in our hygiene chairs every day. The average dental practice sees roughly 20 hygiene patients per day, which can add up to nearly 50 or 5,000 hygiene visits every year. And research suggests that 60 to 70% of adults have some level of malocclusion that could benefit from orthodontic treatment. Now, it doesn't mean everyone needs treatment, of course, but it does mean the opportunity already exists within the patients that we're seeing day in and day out. The time advantage of orthodontics. Here's another important distinction about orthodontics different than other procedures that a lot of us dentists don't think about initially. Most new procedures in dentistry requires the doctor's hands and the doctor's time. Implant surgery, root canals, cosmetic procedures. All of those procedures depend heavily on the doctor being in the operatory. That's where orthodontics is different. Orthodontics relies largely on the time utilized by the dental team, with the process guided by the dentist, which means orthodontics is one of the few services that can be added or increased in volume in a practice while still maintaining our current schedule. So here's a key statistic. When we look at the numbers, it becomes even more interesting. If a practice simply starts 2 cases per month, and the average orthodontic case fee is around $5,000 to $6,000, that represents close to $120,000 in additional annual production. And those patients are already in our doors. So another common fear would be insurance will ruin the economics. On the contrary, really insurance is already ruining a lot of the economics in our practice. Orthodontics and some of the other procedures, like I mentioned, implants, Botox, surgeries, they have less control. Insurance has less control over our take home on those. So while most procedures we're writing off anywhere from 35 to 45%, orthodontics tends to work a little bit differently. Most orthodontic insurance plans cover around 50% of the treatment with a lifetime benefit around $1,500 or $3,000, which means the majority of the orthodontic treatment is still patient funded. Patients expect to invest in improving their smile. And that's one of the reasons orthodontics can be such a powerful addition to a general practice. It allows dentists to provide a life-changing service for their patients while also helping reduce the financial pressures created by heavy PPO dependence. So in this upcoming series, we're going to explore some of the most common fears dentists have about orthodontics and as well look at the facts behind them. Because very often, the opportunity to provide orthodontic care is already sitting in our practice. We just have to start to look for it.